Hey guys, welcome and welcome back to this channel. If you're new here and you have not subscribed, kindly subscribe, like the video, share, and comment. Please, today you will forgive my voice is terrible. So, guys, I'm going to talk about one of the most asked question in an interview. We are still continuing with interview series, how you can handle your interviews, what you can expect, or how you can answer some of the question when you go for an interview. So guys, today we are going to tackle how you can answer one of the most asked question usually is what tell us your strength and weaknesses, or what are your weaknesses and what are your strengths. This is one of the most asked question when you go for a nursing interview. So most of people will usually wonder, how will I answer this question without hurting someone who is interviewing me, or without losing the chance of getting of securing a job, especially when you are asked what are your weaknesses. You should answer this question carefully, because at the back of your mind you still need to secure a job. And when you are asked what are your weaknesses, you have to know that this question is crucial and you must answer it with caution. So one of the most asked one of the most common question you will come across in any job interview is, what are your strengths and your weaknesses. At first, the interview question may seem like a trap. Yeah, it may seem like a trap. How are you supposed to talk about your strength without coming off too boastful, or discuss your weaknesses without harming your chance of getting a job? In reality, though, this is a vulnerable opportunity to showcases your skill, to showcase your skills and personality. By having a good understanding of your strengths and weaknesses, you can demonstrate your self-awareness, your ability to improve or fit for the position. In the end, it all comes down to knowing how to answer, and this exactly what we are trying, or what I'm trying to help you know, how to answer this question. So the first step to acting this tricky interview question is understanding why interviewer asked it in the first place. So these are some of the reasons why the interviewers may ask this question. Number one, they want to assess your self-awareness. Being able to identify your strengths and weaknesses is a sign of self-awareness. This is a vulnerable trait in the workplace. Self-aware employees can make the most of their strengths and work to improve on their weaknesses. Number two, they might ask you this question to see whether you can improve. Everyone has a weaknesses, even those who are interviewing you, but not everyone work on them. As such, when you ask when asking this question, the interviewer want to see whether you are the type of person who actively work on improving your skills and yourselves. Number three, the reason why they can ask you this question is to learn about your work style. The way you answer this question can reveal a lot about your personality and your work style. Number four or number five is to evaluate if you are the right to fit the job. At the end of the day, the interviewer want to know whether you have the necessary skills and work experience to succeed in the role. In this regard, your strength can be want to prove you are right, or you are right to fit whereas your weaknesses can show what area you need to work on. And the last one, they want to see how you can handle tough questions. Talking about your weakness can be stressful, and interviewers may use this to see how you handle the pressure. Now, let us go to some of the tips on how to talk about your strength. Now that we got the whys or the reason why out of the way, let's talk about some practical tips. You can take advantage of them discussing your strength. So now the first tip is be relevant. You should mention your strengths that are relevant to the job you are applying for. Like when you are a nurse, you should mention the strengths that are related to nursing, or the specification. Or if you are a pediatric nurse, mention the strengths that are related to pediatrics. Number 2, back up your claim. To really make an impression, back up everything you say with evidence. Instead of saying I'm a great leader, say something like, I'd say my strength is being a team leader. In my previous role, I led a team of 5 that increased company sales, or increase when maybe if you're dealing in this case we are talking about nurses, you will say it increases the care of the patients. And the number 3, show humility. While it is beneficial to show off your strength, it is just as important to show your humility and acknowledge you still have room and willingness to learn and grow. And number 4, be authentic. Don't exaggerate or embellish your strength, and most importantly, don't lie about them. Yeah. And number 5, emphasize how your strength can benefit the hospital. Yeah. Or maybe if you are looking for a company job, emphasize on how your strength will benefit the company or the hospital as much as you can. Tie your strength with backup to how they can benefit the hospital and contribute to the success of giving the care to the patient. So these are the samples of some of your strengths you can mention in your interview. Number 1, continuous learning. You can say, my greatest strength is my passion for continuous learning. For example, whenever new cases arises, I usually go and search more on it. Or whenever we have a different case in hospital, I usually go search on it and find out what can be done, what are the improvements can be made. Yeah. And then number 2, you can say collaboration. So how would you make your statement on this? You'd say, it is my ability to work well with others. I have always enjoyed working as a part of a team and find that my collaborative nature is one of my strongest professional attribute. And then number 3, you can say writing skills, and you'd say, my greatest strength is my writing skill. I take pride in my ability to write with clarity and precise, because in nursing we have documentation, and documentation is very key. So you can emphasize on that. You can talk about empathy. My greatest strength is my empathy and my ability to relate to people and understand their need. In nursing, we usually say you have to empathize, not sympathize. So you will emphasize on that and give an example if of any case, so that employees knows how you can handle a lot of cases, especially maybe when somebody has lost their patient, or maybe if you have to break a bad news to the patient of any condition here. And then the last one, those are the examples that I'm going to talk about. Problem solving skills. Yeah, you know that when you're a nurse, you can be their leader. So you can say, my greatest strength is my problem solving skill. I pride myself on being able to quickly and efficiently analyze and solve complex problems by considering different perspectives. And this is very common in hospital. Maybe if you are a leader, you will get some staff coming to the hospital when they are drunk, and maybe that one can add you an advantage on that. So let us look at tips to talk about your weaknesses. Effectively, highlighting your strength when answering the strength and weaknesses question is only half of the work. The rest is about discussing your weaknesses, and this is where we get discussing your strength can be very easy, but talking about your weaknesses, because sometimes you can think or you might think that you might hurting someone who want to employ you. So the rest is about discussing about your weaknesses the right way. After all, you don't want to be one of those candidates who make the interview mistake of answering with something like, my greatest weakness is that I am perfectionist. The interviewer will not appreciate your lack of self-awareness and inability to talk about your weak point. At the same time, you don't want to mention a weakness that can actually ruin your chances of getting the job. E.g., saying your weakness is impatient while applying for a role as a nurse is very, very wrong. So, how can you talk about your weakness in a way that shows self-awareness and willingness to learn? So, here are some of the top tips. Be honest but tactful. Talk about your genuine weakness, but avoid mentioning a weakness that is critical to the job or that is too personal. E.g., my weakness, my weakness is that I'm unlucky in love and often get used by people. That is not a weakness that you should talk about in a job interview. That is too personal. Another point two, or tip number 2, talk about your self-improvement. Actions speak louder than words. Explain just how you are working on overcoming your weaknesses by highlighting the step you have taken or that you are currently taking to improve. Show willingness to learn. That is point number 3. Yeah, show willingness to learn. When you are discussing your weaknesses, make sure to stress that you are open to feedback, advice, and help to continue learning and growing. And number 4, highlight strength. For every weakness that you mention, show that you possess a strength or a skill to compensate for it. For example, if you mention public speaking as a weakness, you can say your creativity compensate for it. Okay? And then number 5, be specific. This apply to literally everything job application process related, interviews included. The more specific you can be about an example, where you identify a weakness where you identify a weakness, overcome it, or return it into a strength, the more you'll be able to impress the hiring manager. Practice your responses. Talking about our weaknesses does not come easy to most people. So don't let this question catch you off guard. Check the job description and role requirement in advance. Think about genuine weakness that won't penalize you as a candidate, and practice your answer before the interview to deliver it as confidently as possible. Now, some of the weaknesses that you might mention. Number one, self-criticism. One of my weaknesses is that I tend to be overly critical of myself after completing a job, or even after completing a procedure. Even if it is receiving a positive feedback, I often feel like I could have done more. So this can lead to overworking and burnout. Yeah. You can talk about avoiding confrontation. I tend to avoid confrontation both in my personal and professional life. So while I believe it is important to maintain a harmonious work environment, I understand that conflict can arise and need to be addressed promptly. I am taking steps to improve in this area by developing conflict resolution skills. Okay, you can talk about insecurity. My greatest weakness, you can say my greatest weakness is my tendency to second guess myself and my ability. For instance, I sometimes doubt my work and worry that it may not be up to the required standards, even if it is. However, I am taking steps to overcome this weakness. I have been working on building my confidence by reminding myself of my past accomplishments. Those are some of the weaknesses you can mention, and those are some of them. That is how you can answer them. So guys, I will stop from there. In case you have any question, in case you want to talk, you want me to talk about anything related to interview, especially for nurses, let me know in the comment section. I think it's going to be helpful to one or two people. Yeah. So I will say bye till next time.